Okay, so for this next tutorial, we are going to discuss setting up a patient for non-invasive ventilation using the Drager V500 platform. So here I have a Drager V500. It is now in the startup screen, so we are going to select new adult. So that way we can put our new settings in. And bear with me, the vent is going to chirp. There we go. Just hit alarm reset here. Yes, I know I have a calibration indication is the reason why this is in the lab right now, not on a patient. Okay, so looking at our settings here, so very different from the Hamilton. Before you begin delivering NIV to your patient, you have to change your interface. So to change your interface from the start and standby screen, you will select tube NIV tab here, and then you're going to change the application mode from tube to NIV. Now you can see you have an orange banner here on top, which will indicate that your vent is in non-invasive ventilation mode. And you can only toggle between these two application modes and changing them back and forth from the standby menu. So your patient is not going to be ventilated during this period of time. So we're going to go back to our start standby menu here, and we are going to we are going to select ventilation settings. Now you can use any one of these modes in non-invasive ventilation, but if you're going to apply, you know, CPAP or BiPAP settings, so to speak, there's about 3 of the modes that you can utilize to do that. So let's talk about spontaneous CPAP pressure support first here. Okay, in spontaneous CPAP pressure support, you have your FiO2 settings, you have your I-time max, you have your PEEP, your pressure support or your delta P, and your slope. So you also have a backup ventilation mode. So should your patient become apneic, it will switch to this backup ventilation mode of 600 by 12. If you want to change that, go to additional settings, and under apnea ventilation, you can select how high a tidal volume you want to deliver your patient. If you don't want them to receive 600, you lower that down to about 500, and then also the backup respiratory rate. So it's very important that you keep this on just in case your patient does become apneic. Now looking at your trigger here, you can set your flow trigger and your inspiratory termination point. So additional settings, and we are going to go back to general settings here. Okay, so right now I have my patient set up to receive 5 of CPAP. So if I believe that the patient may need additional pressure support, I can add additional pressure support if the patient has difficulty reaching those volumes. So looking at these settings, if I were to translate these settings over to a V60, I'm looking at a setting of 10/5. So an IPAP of 10 and an EPAP of 5, which would give me a delta P of 5. So that's how I would translate those settings to a V60. So that is one option you may use. You also have pressure control, pressure support ventilation, in which case you can set a peak inspiratory pressure. The peak inspiratory pressure is very similar to your IPAP setting. So to set your pressure support, you would need to make sure that your peak inspiratory pressure is set accordingly. As it is set up right now, that patient is set up for a driving pressure of approximately 15 centimeters of water pressure, 20/5. So increase my peak to 10. So there we go. 20/10 will give me 10 of pressure support for that patient. So there's a couple of differences between these different modes that you just have to pay attention to the nuances of these modes. So here, you're also setting a backup respiratory rate instead of having a backup ventilation mode. So you can also use pressure control, assist control. So here you can actually set an I time and say, let's go back to pressure control, pressure support, where you set your I time max. Here you can actually set your I time. So again, you're setting your peak inspiratory pressure and your PEEP, or CPAP. You're setting your respiratory rate and of course your slope setting and your FiO2 setting. So it really depends on, you know, what your patient needs are at the time. I tend to prefer the pressure control, assist control over pressure control, pressure support, mainly because I can go ahead and set a night time, but it's really whatever you prefer or what is more comfortable for your patient at that time. So that is the overview of the settings. So for the mask is the exact same setup for the Hamilton G5. We have an expiratory valve on this ventilator. We do not need our white elbow with the valve on the elbow. So we'll go ahead and remove it. We'll grab our blue elbow, clip it onto the mask, and now the mask is ready to be placed on the patient. So we would attach it directly to the Y of the circuit. And then once we are ready, we'll go ahead and hit start ventilation. So as you can see, I am still in non-invasive mode. Got the orange banner with the little guy with the mask here, and I'm in pressure control, assist control. So I have a test lung here and I'm initiating some breath so you can see what it looks like here. So your status screen, settings, everything is the same as non-invasive. That is all the same. So right now I have just a backup respiratory rate of 12, 20/10. So my patient is getting 10 of pressure support to help take bigger volumes in. If you need to switch back to invasive mode, so if your patient gets re-intubated, you will have to go into standby. Acknowledge. And you will return to tube NIV tab up here. And you will switch the application mode back to 2. And there you will put your information on your airway, whether it be an ET tube, trach, and what size. So that is an overview of setting up NIV on the Drager V500. I hope this was helpful, and if you guys have any questions, please leave a comment, or you can shoot me an email and I will answer any questions that you have. Have a good one.